All right, so our next speaker is going to be Cheryl Harris. She is, like Johnny mentioned earlier, she is from the SHINE program at Elder Options, and that is a state program. She'll go into a little bit more details about that, but thank you so much for joining us, Cheryl. And if anyone has any questions, feel free to put those in the chat box, and we'll talk about those at the end of the presentation.
Thank you, Sam, and the Savvy team. Thank you for asking me to speak and present today. I appreciate the opportunity. As Sam said, I am the SHINE liaison with Elder Options, and I'm going to be telling you about the SHINE program and some tips about Medicare, and then how the SHINE program can assist. So here we go. I'm going to share my PowerPoint. All right, so if Sam or Johnny, if I run into any hiccups, let me know if you're not able to see something appropriately. So we are in the throes of Medicare open enrollment period. So I want to give you some tips about that and give you just a quick overview about the SHINE program. So our mission is to provide free and unbiased health insurance counseling through a dedicated network of volunteers, empowering Florida seniors to make informed healthcare choices. And that is the real crux, absolutely, of what we do. We're here to provide free and unbiased. And throughout my presentation, you'll hear me say that several times, because that's what it's about. And we want people to be informed consumers about their healthcare options. We just find that many times people do not fully understand what coverage they currently have, but we want to give them information so that they can make the appropriate choices. We also administer the Senior Medicare Patrol, which that mission is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse through outreach, counseling, and education. When we read this disclaimer, the part that we want to focus upon is that our services are free, unbiased, and confidential. We are not affiliated with, nor do we endorse any insurance company or product. So again, we're just here to provide that unbiased counseling. This is our picture of the state of Florida, showing you our 11 different agencies. And so our area for Elder Options is right here in the middle, PSA 3. And we serve a 16-county region, but no matter where you are in the state of Florida or throughout the United States, we have a program that is here ready to assist you. So SHINE stands for Serving Health Insurance Needs of Elders. And we are here to assist with all things related to Medicare. Be it someone who is new to Medicare and they need a better understanding of the different paths of Medicare, either receiving their benefits through original Medicare or looking at what their options are for Medicare Advantage plans. We go through to inform people about what their options are for their prescription drug coverage. We tell folks about how to connect with a Medigap policy in their area. There are 2 different assistance programs that can help with Medicare cost. The Extra Help for Prescriptions is administered through the Social Security Administration, and that there's a threshold for monthly income and overall assets to qualify for this program, and as well as there are different levels of qualification. The Medicare Savings Program is administered through the Department of Children and Families, and this helps with your Medicare Part B, as in boy, cost, and depending on your level of qualification may assist with other expenses as well. I talked a little bit about the Medicare fraud and abuse, and that is another one of those areas that we help people with. Long-term care planning, and then also with Medicare complaints and appeals. We help a lot of folks with issues that come along with a claim that was denied payment. So we are there to help them through that process to appeal to get that paid. But right now, the Medicare open enrollment period runs October 15th through December 7th. And these are for folks who are already enrolled in Medicare. This is their opportunity to change or add coverage. And we're going to step through a little bit of what those options are. But when you make your changes, your choices between October 15th and December 7th, the changes become effective January 1st. But Shine is here to help people understand what their options are. So by the end of September, an individual who is already enrolled in Medicare should have received what is commonly referred to as an ANOC, an annual notice of change. And what we're finding with some Medicare beneficiaries, they might have missed getting that because we're seeing that more of these companies are not physically mailing the information. They are many times are emailing it, or they're sending a notice that says, if you want this in its entirety, you have to notify us. So this is one thing we want to make people aware of, that these plans change every year and you should receive notice of those changes. It explains, is there going to be a change in the monthly premium? Is there going to be a change in the deductible? There could possibly be changes in copays and coinsurance. And specifically, if you have a standalone prescription drug plan, what are some changes in the drug formularies? You might have seen many advertisements right now, especially on television, and maybe have received a lot of mail. So this marketing begins on October 1st. We encourage people to take time to consider the options and to not be pressured by anyone who should call you or even come and knock on your door. They're not supposed to be able to do that, but we always receive complaints that there are marketers in communities. This is a lot of what the SHINE program tries to provide when it comes to helping people understand what their options are and what the two basic paths of Medicare are, and understanding your options with both paths. One of my common phrases to use with folks is that you can't drive down, or you're not supposed to be driving down both sides of the street at the same time. So with Medicare, you have two different paths that you can choose. Original Medicare, you have your Part A for your hospitalization, your Part B that in simple terms are your other parts of your medical, exclusion being your Part D prescription drug coverage. And then you also have your Medigap policy, which would cover the gaps of what original Medicare Part A and Part B did not cover. So we walk people through what the different costs are associated with the path of original Medicare and what options you would have for coverage. The other path that people often confuse is this Medicare Advantage path. Many times I hear people say, well, I don't have Medicare anymore. I have a Medicare Advantage plan. Sometimes they're called Medicare health plans. Sometimes they're referred to as Part C or a Medicare Complete plan. So people who have chosen this path of Medicare, they still have Medicare. They're just receiving their benefits through a private insurance company. And in our world today, we call this bundling of benefits. So the same benefits you received under Medicare Part A and B are bundled with this option, the Medicare Advantage plan. We see that there are a lot more perks, so to speak, that come with getting people to sign up with this path. And there are additional benefits that come through this path, but you have to count the cost if you go this path versus this path. There are pros and cons of either path, but every individual has to decide what is the best path for them as related to cost and what their needs are, as well as where you live, because Medicare Advantage plans are offered county by county. And so what one plan, very healthy plan that may be offered in Hernando County because it borders in the Tampa area, may not be offered in Alachua County. So we just try to help people decide what and weigh out those options as to which path is best for them. So what can you do during open enrollment period? So before we begin looking at the options during open enrollment period, it is important to understand the critical term of credible coverage. The concept of credible coverage originates through the Health Insurance Portability and Accountability Act of 1996, also known as the HIPAA law. Credible coverage is that which meets or exceeds Medicare's minimum benefit level and gives day-for-day credit for previous coverage. Credible coverage helps avoid late enrollment penalties for Part B as in boy and D as in drugs. So when we are looking at what you can do during Medicare open enrollment period, one thing you can do is if you are on original Medicare path, you can look at your options to switch from one prescription drug plan to a different prescription drug plan. It's very important that you understand what options are available in your county. Right now, for the year 2020, we had 27 prescription drug plans that were available. That's the most we'd ever had since I had been with the SHINE program. Well, for the year 2021, we have 28 prescription drug plans that are available. So we have to look to see what plans are available and what is your preferred pharmacy where you like to get your prescriptions filled. Every year there is a change with the formularies with these companies. So we want to make sure that we appropriately, in the Medicare Plan Finder, enter all of your medications, and then the Plan Finder will tell us what is going to be your lowest cost option for that year. And a SHINE counselor can help a Medicare beneficiary achieve this. Now, if you had failed to pick up a prescription drug plan, originally this rolled out in 2006. And someone in 2006 may have said, you know, I don't take any meds and I don't want to pay for a prescription drug plan. And so it's during this period that someone can add prescription drug coverage. But if there was a delay in adding that coverage, there may be a penalty if the person did not have credible coverage through another avenue, such as a retiree plan, an employer plan, or through veteran benefits. But this is the time to get enrolled. Another thing that you can do during open enrollment is if you were on this path with original Medicare, you can switch to a Medicare Advantage plan. But a SHINE counselor can help you figure out and count the cost. What are your out-of-pocket expenses going to be? Are all of your doctors in network with the Medicare Advantage plan? And are all of your prescription drugs, are they going to be covered if you switch path to a Medicare Advantage plan? Another option you can do during this period is to switch if you were on a Medicare Advantage plan and you want to go back to original Medicare. Now is the time that you can make that switch. Again, we want to help people compare their out-of-pocket expenses. And when you make this switch, we want to make sure you evaluate your options to add a prescription drug plan so that you don't go without coverage. And when we evaluate this, we need to know, are all of your drugs covered when you switch back to original Medicare? And we can help you evaluate your options to pick up a Medicare supplement, also known as a Medigap policy. Another thing you can do is you can switch from an Advantage plan to another Advantage plan. Again, we are seeing more options available for 2021 than we've ever had previously. So one option is a PPO, and you can switch to an HMO or from an HMO to a PPO. And we're also seeing that there are other types of plans that are available this year. We will help you compare your out-of-pocket expenses. We need to call your doctors and find out, are your doctors in network if you change plans? And again, are your prescription drugs going to be covered if you switch? So you can switch from a PPO plan that had no drug coverage and switch to a plan that does include prescription drug coverage. But if you did not previously have credible coverage with your prescriptions, their penalty may be assessed. So several ways that you can reach out to us and we can help you is to call, the individual can call the 800 number for the Elder Helpline and request to speak to a Shine counselor. You can also go directly to Medicare. You can evaluate your options if you know how to navigate the mymedicare.gov system. You can call 1-800-MEDICARE, and they're open 24 hours a day. And you can also call the plan if you know which plan that you want to enroll in. But we are here to help and help you step through that process. We also will help you, we will screen to see if you apply, or your particular level of income and assets will make you qualify for the savings programs, the two assistance programs I spoke of earlier, the extra help for prescriptions, as well as the Medicare savings plans. So although we are not able to meet face-to-face at any of our counseling sites right now, we are available by phone. We're also available for counseling through web-based platforms such as Zoom. Last thing I want to bring out to you is that we are seeing a lot of Medicare fraud and abuse, and unfortunately, Florida is number 2, California is number 1, and Florida is number 2 when it comes to fraud and abuse. And we are here to assist people with this type of errors that come along, and also with fraud, with the purposefully billing of services that were never given, or to bill for a service at a higher reimbursement than the service that was actually produced. One of the things that we're seeing right now is a lot of fraud activity around COVID. And I won't do a deep dive on this other than to say, please make sure that your testing is coming through a credible healthcare provider that you are familiar with. We're just seeing so much fraud right now along those lines. So I'm sure many of you have gotten those robocalls, and we have seen those come through a lot where they call and ask, have you ever had pain? Do you need a back brace? Do you need anything along those lines? Well, if that happens to you and you receive a back brace, knee brace that you did not even request, We are here to help you with that. We want to help people understand how to prevent the fraud. And then when it did happen, when you detect that there has been mistakes or possibly actual fraud with your Medicare summary notice, we teach people how to read that. And then once you've detected that it has happened, that Medicare fraud, then report that to us and we can step you through the process of having that removed from your Medicare summary notice. All right, so I'm going to stop my share and let's see. Sam, are there some questions for me?
All right. I don't see any at the moment. So if anyone has any questions before we wrap up, just feel free to leave them in the chat. You can always contact Shine as well if you have any questions.
So we're here if people are new to Medicare, we can help step them through the process of how to get started. No matter, we're open all year long. So we're here not just during open enrollment period. We're here all year long to help with those issues that come along. And we want to help people save money. I want to, Sam, if I got a few more minutes, I just want to tell you about an example of my mom. My mom, when I started with the Shine program 5 years ago, and I was telling her what I was going to be doing, she said, well, I'm really glad to hear that because I haven't told you, but I wasn't sure how much longer I was going to be able to afford all of my medications. So I got her connected with the Shine counselor, and what I discovered was that from the time she enrolled with Medicare at age 65, she had never changed her coverage in all that time. And she had the original Medicare path. She had a great supplement, but her prescription drug plan, she had never evaluated. So the very first year that we did a comparison for her, and she was willing to change her plan and change her pharmacy, because that's important as to the pricing that comes with the pharmacies. The prescription drug company, the insurance companies, they have contracts with the pharmacies. And so to get better pricing at places that are a preferred pharmacy. So when she was willing for us to evaluate, she saved $1,300 that very first year by changing, and that's an annual cost. So a little over $100 a month is significant for many families, including my mom. And so that was year one. Within the second year, I said, okay, we need to evaluate your change. It's October again. And she's like, you have to do this every year. And I said, yes. So the second year, she saved $650 by changing from that plan she was on to a different plan, and she had to change pharmacies. So in a span of 2 years, she was saving, just under $2,000. And so again, for my family, that's a lot of money. And then, so when year 3 rolled around, she said, Cheryl, it's October. Do you need to get me connected with this Shine counselor? And I said, well, yes, it only took 3 years, but we got there. So she knew it was time to do that. And again, every year she has changed, and she has been able to save money by changing. So Renee has sent a message, says, what kind of paperwork do you have to bring for an appointment? So if you request an appointment with a Shine counselor, you're going to need your red, white, and blue Medicare card. You're going to need a complete medication list, and not just say, I take lisinopril. We need to know the dosage and how many times a day you take that medication. And we need to know, is it a special formula? Is it an extended release tab or anything along those lines? So we need a complete medication list. And then if you have a mymedicare.gov account, we'll need that information to help you log in so that we can, it's a little faster when you have a mymedicare.gov account. We can get into your account much quicker and evaluate your options. So the question came in is, when should I see you if I'm turning 65 soon? Great question. So We recommend at least 4 months before the month of your birthday. Your initial enrollment period with Medicare is, there's a 7-month window. There's the month of your birth, 3 months prior, and 3 months after. But if you don't want any delay in coverage, if you're going to be starting your Medicare at 65, we recommend you start with us at least 4 months ahead of time. That way we've got a little bit of time to work on some things and help you through the process. If you delay starting your Medicare because you're in the working world and you say, you know, I don't want to start Part B as in boy because I've got credible coverage through my employment or through my spouse's employment, you can delay getting your Medicare Part B. But if you need some help after that, suppose you work till you were 67, 68, then we can help step you through the process of all the things you need to do because there is some paperwork involved. And right now, with everything being not as expedient because of COVID, we recommend that you get started on that as soon as you think that you're going to need to get that going. So you've got that 7-month window, but we do recommend 4 months prior to your month that your Medicare starts. And then also we recommend, we have some online classes as well, so that if you take some of those classes to get a better understanding of how Medicare works, and then again, be an informed consumer. Okay, so there was another message that came in that says, what if I do not have my Medicare.gov account? It is not an issue. We can still assist you. We can do a general search whenever we enter the meds into the plan finder. It just takes a little longer because we've got to enter those meds. And so if someone has 25 or 30 medicines, it takes us longer to enter it. Whereas if they have a mymedicare.gov account, we can go right into the account and the medication's already there. But absolutely, we still can assist with that. And if you're in Alachua County, we are having our counseling available by Zoom every Tuesday mornings. We would love to have you join us. And even if you're not in Alachua County, if you request to join us on Tuesday mornings, we have, and these are private one-on-one appointments. We start at 9 o'clock and we run through 1 o'clock. But whatever county it is, we will do our absolute best to connect with you as soon as possible. Any other questions?
All right. Well, thank you so much, Cheryl, for taking time out of your day to come and share that information with us.